Good afternoon, good morning, actually, everybody. It's morning time here. I've been up and at 'em, and it's a beautiful day out, so it feels like it's already afternoon, when in fact, it's still the morning. Welcome to Wellness Wednesday. I'm Susan Bahoric, also known as Sentara Susan, and it might be February, but it is absolutely gorgeous today. As we've been talking about all month long, February is Heart Month, and that means we're talking heart health, what you can do, and we are joined by a very special guest this morning. We have Dr. Rai. He is an interventional cardiologist. And you know, it's funny because working for a hospital, I know that a cardiologist is somebody working with your heart, but I'm learning a lot more, and I'm sure you guys are too, about interventional radiology, or rather interventional cardiology and everything that comes with cardiology. Dr. Rai, hello.
Good morning. Good morning.
For those who don't know, like myself, what exactly is interventional cardiology?
So interventional cardiology, in simple terms, is like a plumber for your heart. So the general patients I treat are patients with heart attack when they come in with a blockage, and we open up the heart arteries with a stent or a balloon, generally a stent. And we also treat patients with chest pains who come in electively to our office, or say shortness of breath or an abnormal stress test. We take them to the cath lab, we take pictures of their heart arteries, and if needed, we'll implant a stent to open up the artery and improve the blood supply to the heart artery. So in simple terms, it's like a plumbing of the heart.
Okay. Now, you just spoke to the folks here at Mall Walkers, which is, we do an Ask the Expert series every month, and it's very well attended, and today's was super well attended because I think a lot of folks had heart issues, or maybe loved ones with heart issues. One thing that I remember a person asked you was about a stent, and how long could his stent last? Because he was a stent owner, user, patient, and I think he had maybe some concerns. I thought your answer was really interesting.
So, you know, the stents, there are two types of stents. The current or the newer generation stents, what we call as the medicated stents, they're open. I mean, if the likelihood of those stents re-occluding or or plaque formation in those arteries are less than 10%. So if they're open, I mean, 90% of the time they're open, and once they're open for life.
Okay.
In the sense, you know, after a period of time. Generally, if it starts re-occluding, you will see it sooner, within the year or so. Mm-hmm. Rarely, very, very rarely do we see it, you know, they come in later in life. So the short answer is 90% of the time they remain open, and once they remain open, you know, they're for life.
That's awesome.
Yeah.
And you know, I mean, that's why it's so important that when you have those patients and say to those patients, hey, come back in for your follow-up, that's why you have those follow-ups, because you never know. You know, you got to maintain that heart health. What do you want? You were saying that there's what are the risk factors? Are there some people more than others likely to come in and be knocking on your door as a future patient or as a patient?
Actually, it's a very good question. One of the main things is, you know, the last gentleman who asked me a question is about, he said his father had a heart attack in his 50s, he had a heart attack in his 50s, so he was concerned about his son, who was in his 40s. So family history is a very big, important risk factor. Again, the things what you can change are risk factors such as smoking, alcohol, you know, drug abuse, sedentary lifestyle, if you're sedentary exercise, if you have high blood pressure, control your high blood pressure with diet and exercise. High cholesterol, again, very important. Diabetes has to be controlled. Those are the things which are easily treatable and taken care of.
Okay. And, you know, the group here is Mall Walkers, so they're walking every day, and you had even said, hey, folks, you know, this is great because you're really taking an interest in your health and your healthy heart.
That is true. It's very impressive. You know, they're very active. They walk for about 30 minutes or 40 minutes, and I was talking to one of the ladies. Her husband walks about 5 miles every morning. They're doing all the right things, seems like.
One thing I always heard was something about a baby aspirin. Is that a myth? Is that something that you say, hey, go for it? Should I be having a baby aspirin? I don't really have a heart issue history, but is that something that maybe I should start working into my regular everyday?
Very good question. If you have heart disease, yes, you do have to be on baby aspirin. With regards to people who don't have any medical problems, no need of a baby aspirin. There's no data supporting that. With regards to if you have diabetes, high cholesterol, if you're in a higher risk, the data is not very strong, but yes, I would suggest a baby aspirin to be taken, and definitely discuss with your primary care doctor, or it all depends on this thing. If you don't have any issues, I don't see any reason for you to be on a baby aspirin.
Wonderful. I know you're a busy guy and have a lot of things going on today. My final question, what do you wish that your patients knew before they came into your office and were sitting on your exam table? What do you want people to know if they can only take one thing with them?
Prevention. Prevention is the best thing you can think of. If you take care of yourself, if you do the right things, if you're a smoker, stop smoking. If you're an alcoholic, stop drinking, or drink with moderation. What we call is 1 or 2 drinks of or glasses of wine is supposed to be good. If your diet is bad, make changes with your diet. If you're a diabetic, and if it's make sure that diabetes is well controlled. If you have hypertension, make sure your blood pressure is. Those are the things. Prevention, prevention, prevention.
Okay, you've heard the saying before, what is it? An ounce of prevention is worth a pound of cure. You heard it from Dr. Rai. He's a cardiologist. He's an associate professor over at Howard. He's
used to be. Assistant.
Oh, pardon me, assistant. I'm giving him a promotion. But he's a smart guy. He's basically saying prevention, prevention, prevention. So that means cut back on the bad food. Cut back on the smoking, the drinking, start eating a little healthier, work a salad in every now and again, and get the exercise in. A few extra steps in your life is a good thing. And then
10,000 steps.
That's right. I was going to say, and Dr. Rai, he's a great guy, but he'd rather not see you. So, all right. Thank you, Dr. Rai. And he was our inaugural guest here on Wellness Wednesday. And if you have any suggestions for Wellness Wednesday, please let me know at sxbahori@sentara.com. In the meantime, I'll be talking to you soon. Take care, everybody, and please be safe out there.